further ado, I think we can probably invite our first speaker.
So I think the first speaker, I think we're going to settle with him, shall we?
Yeah, I think so. I think he's a man who is well known to all of us. He needs no introduction. But very briefly, Dr. Suhail Chughtai, he's an orthopedic surgeon. He will be telling us about Medical City Online. So without further ado, Dr. Suhail Chughtai, please.
First of all, thank you very much for turning up. This being a weekend for the bank holiday, and not easy for people to come out when the Monday is a bank holiday. Traffic was bad. Thank you for coming, the Aga Khan faculty. You have taken special effort to be with us, and we really welcome you very much. I welcome you on behalf of two organizations. The Association of Pakistani Physicians and Surgeons. I represent them as the chairperson in south of England and London. So that organization welcomes the Aga Khan University faculty very much. I also want to welcome the guests, all of you, plus the key speaker from the behalf of the World Congress Overseas Pakistanis. They are the organization who have been very prominently reflecting Pakistani diaspora's interests, engaging them, and so they also welcome you very much. I'm their president for UK. Today's event is academic, but in a general sense. So we are not giving you pure medical knowledge, but a medical knowledge with healthcare advice. I want to share one of the projects I have, which entails healthcare in a slightly different way than traditional. So, innovations in telemedicine. The prediction is that by 2025, 35% of world healthcare will be over internet. So 1 in 3 people will be actually seeking advice or getting training on internet. That is phenomenal. That is done by Forbes, because they find that IT is the fastest growing sector, and within IT, telemedicine is the fastest. So the vacuum will be not before 10 years. So there's a constant upscale growth of 175% minimum every year for the next 10 years. So this is important area. You will be either a victim or a provider in this. So I think let me share some thoughts. I've been working on this for nearly 15 years. I've given 15 years of my life to IT, being a Microsoft certified professional. And I want to share some of the thoughts, some of the products which can benefit us as patients and doctors both. So this is the project, Medical City Online. My vision is that there should be one stop on internet, without any gadgets, without any downloading. Just go to laptop, find a doctor, get training from a doctor, share your knowledge with other doctors, or if a doctor is in trouble, like he wants to show you an X-ray, be there available. And this Medical City is covering every aspect. I'm going to just touch telemedicine, which is a very small part of this whole project. Telemedicine is basically, as you know, that put all the telecommunication services in one window and all the healthcare services in one box and connect them. So all the telecommunication services, telephone, email, and nowadays one-way video, like you're talking, like this program is being relayed live. That's one way, or two-way communication in real time. All these telecommunication services, and then let's go to the healthcare services, which can be simple advice, which can be prescribing medications, which can be actually planning management, or giving treatment like psychotherapy. So all these healthcare services, all these telecommunication services, put them together. That is telemedicine. Now, why telemedicine? Because it gives you instant access to a doctor sitting in Cleveland Clinic when you're in Sialkot. It gives you access to immediate advice of a psychiatrist, for instance, and you can't take it because there's a stigma in society that you've seen a psychiatrist. So privacy, availability, cost of traveling to Cromwell Hospital, London from Pakistan, and lots of things. I mean, this can be a long a list of benefits, and I'll leave it to your imagination. You're all doctors and most of the medical professionals here. Post-operative follow-up, one is important. Patients traveling from Gujranwala to Lahore to show a wound on the shoulder and just taking some advice and going back all the way. Why not have the nurse there and do a telemedicine session and see the wound? I presented in Aga Khan University at the annual surgical conference this topic, that Aga Khan can be a hub and we can have spokes in Sakhar, Hyderabad and all the cities. So patients don't have to travel. Patients who cannot be seen on internet, only they can travel. And imagine how much benefit, not only service provision, financial benefit you will gain, because you will replace the actual appointments in clinic by new patients coming which actually need to see you. Plus convenience, plus you have the archived data in system for research. You can look back at all the consultations, compute it, and see how many patients from that city, that village, got to you under 65 and what kind of problems they had. It's all archived. The benefits are enormous. I've been into this and I can go deeper and deeper, but time is short and we want to give time to the gentleman here. So how to do telemedicine? Now this is important to understand. I want to just take 1 minute of your full concentration. Dr. Alia, when you see a patient, do you take history? Do you think it's important? With experience, people can diagnose a patient merely on the history. Dr. Naim is here, Dr. Ishtiaq Rizvi, Dr. Rahman Khan, all the colleagues are here. They can tell that history actually can reach you to a diagnosis before you can actually start investigating, because of your experience of listing the same answers for the years. So history. Can you not take history on live two-way video? You can. Okay, history is one. What about medical investigations? Looking at CT scans, looking at medical records, and looking at blood tests. They fill the gap of history. You confirm or exclude. You can do that on sharing screen, which I'm going to show you in a minute. So you share the screen between you and patient and discuss investigation, blood test. The third part, that's the difficult one. When I ask a patient, when I want to check a patient's external rotation, being an orthopedic surgeon, do I actually put his hand, hold his hand and put behind the head? I don't. I ask him, just take the hand behind your head. Just take your hand behind your back and just turn around and show me where it goes. When I do carpal tunnel syndrome testing, I ask him to do this and keep it there for 1 minute if the fingers go numb. Can I not do that on visual examination, on video? Okay, watch out for my book. It's coming, and I'm going to replace a lot of physical examination with visual examination suggestions, and that is what I believe strongly, that people will not be needing physical examination. Of course, when there is a gap, there are investigations. In this country, if I do an ACL replacement without an MRI scan, no matter how much confirmed I am on my clinical examination, I'll be sued because I put my patient in a risk. I have to do MRI scan. So what's the point doing a detailed physical examination? Okay, for psychological benefit that I've done a ACL positive. How many of you carry stethoscopes in clinic nowadays? Not very many. But you have replacement, like there's digital stethoscope. You put them, you record them, MP3, and amplify them and listen to them. And they will even tell you it's a VST with pansystolic murmur. The digital graph can tell you. Potts fracture. It was before the X-ray classification came into being. Nobody uses spot fracture because X-rays came into being. Waddell sign, my professor, I was a student in Glasgow. His signs were because if the patient is maligning a back pain, do the Waddell sign, the spinal axial sign. But when MRI scan came, Waddell signs got out. Now is the time for telemedicine. Hutchinson will go out. Chamberlain clinical methods will go out because things are changing. Be ready for that. My prediction, in 5 years, you'll have a different clinical method books, telemedicine examination books. The time is coming, so I think we should embrace that change. We're going to get there very soon. So this is the principle now. History, review, uploaded records, and do the visual examination rather than physical. And wherever you can't reach, of course, this is not for acute patients. I must say that here. It's not for acute medicine. And 75% patients in hospital are chronic medication. In fact, 70%. If you know the hospital figures, 70% patients in hospitals are chronic patients. So telemedicine has a place, and I think we should embrace that as doctors and patients both. Now, patients, WhatsApp, Skype, Viber, patients know what telemedicine, what video conferencing is. They don't need to be shown all that. Kids know that. If they don't know, they'll ask their kid. So you're not talking to an ignorant crowd. You're not teaching them. In fact, you might learn from them that this video conferencing can be better. So I have no scare that eventually we are getting there where everybody will be. The system I'm going to show you today, just a video, has the capability of a person who can attach a file on email. That person can learn that system in 20 minutes. We've tested that. You pick a person from the crowd. Can you attach an email? Can you attach a file? Yes, you can. Give him the software. In 20 minutes, as a patient, he will learn it. And that is where it was 2 hours before, then 1 hour, 20 minutes, then I brought it down to 20 minutes. So to save time, instead of me showing you more slides, I want to show you a small video of a doctor-patient consultation. Kind of a maid consultation. It's not a real consultation. Just a couple of screens that this is where the patients register. Then doctor sets up clinic, like date, time from, one-off clinic or multiple clinics, and number of slots. So doctor can set up clinic, patient can search for the doctor on the website. Okay, I want this doctor. Book the appointment. Email comes to both sides. And at that time, they click on the link and they start talking. And let's start talking on, let me show you one of the consultations we have recorded here for you. That is the problem. Actually, I haven't addressed that problem.
Good morning.
Good morning, doctor.
Hi, thank you, Agla, for taking an appointment.
I'm just going to stop here for show you the left side screen. This side screen is the doctor's page. So doctor is in the small window and the patient is in the large window. The doctor has multiple sets of tabs. The first set of tabs is where the patient has given the information like CT scan, X-rays, etc., etc. So doctor will go through these tabs to see what patient has provided. Then doctor will do the visual examination on the screen, and then the doctor will register his observations and prescribe treatment. And here is the education tab where the patients and doctors will educate each other, or doctor can tell patient about the problem. So I'll try and stop and skip forward as well.
Let me just go through the form you have filled at the beginning. So
sorry, one more thing. Before we take the history, the doctor can leave a form according to his specialty. If it's a neurosurgeon, he can leave a form saying headaches, history of epilepsy. If it's a dermatologist, he can leave a form of gold allergy or any dermatitis, photosensitive dermatitis, etc. So doctor can leave a form upfront which the patient can fill at the time of registration. So that's a startup. So like I'm talking about this form now.
It's a right wrist pain and your hand goes numb in the morning. Tell me more about it. What makes the pain worse? Can you describe some factors?
When I wake up in the morning, it feels numb. Sometimes if I ride for a long time, or if I...
So that's a history taking part. I'm just going to move forward.
Sometimes I feel like the thing's slipping out, and
Which is a good sign.
So here I am looking at the investigations the patient has submitted or uploaded using a mobile phone or simple attaching a file like this.
And I think here you have had some blood urea nitrogen which was higher before and now it's back to normal.
So that is a real advantage I call, because in normal practice, if patient is sitting over there, I am looking at the file. I'm not able to show it to the patient. Here I can. I can mark it. Patient can stop me. Doctor, stop. This is what is this number? Patient cannot blink eye. I cannot blink eye. And our paper, I'm going to send a paper very soon submit a paper, which says that the patient engagement rate is far higher in telemedicine than actual physical, except in that we can touch the patient. Here you can't touch the patient. That's the only limiting part. But in this one, patient is so absorbed in what you're showing and you cannot skip a page without showing it to the patient. So the communication is much better. And it's a research work as well, Dr. Hassan is here, that patient compliance is better if you engage the patient in treatment. Isn't it? That if you engage the patient in treatment, being an orthopedic surgeon, you know that if you don't engage the patient, they may not comply to your treatment. In fact, they may go to another doctor to take an advice because you haven't really engaged the patient. So here, you engage the patient.
Which is a good sign. Let me see, have you had any x-rays taken before?
I did, yes. I had an X-ray taken on my rib.
So here you can actually share the X-ray with the patient, and patient has just taken pictures of the mobile phone and uploaded them. So you can even mark.
I think this wrist looks pretty normal.
So this way you can actually go, Dr. Hassan can have comments on that. This wrist is not normal, he's saying, and I know that. Okay.
Do you see any?
So here I'm asking a patient to do Tinel sign, which is a sign to tap on the median nerve.
While doing so, does it bring out any numbness?
So I'm actually showing a picture from the catalog that do that if patient can't understand my sign language. So you can pick up these pictures and ask patient to do the same thing in your specialty, not in orthopedic surgery only, in other specialties as well.
Yes, I do.
Okay, so just pressure.
So this is a Tinel sign. You show a picture to the patient, ask to tap the nerve. So in every specialty, we'll find similar sets of treatment or examination techniques.
It's actually the pain. Let me show you how. Just like this.
So this is, I'm showing that what nerve conduction studies mean. Patient asked me, what are nerve conduction studies? So I picked up a picture from the catalog and showed that's how it's going to be done. Imagine the level of engagement you have with the patient in this way.
At this point of time, I have requested your nerve conduction studies. Just for the final thing, I'll just look at your past consultations.
So this is important. You can go in the past consultations of the same patient, either video or in summary form, because whatever I'm doing now will be summarized in an auto-formatted letter. So you just press that, it goes to patient, or it stays in the archives, or it goes to the local hospital laboratory for testing, and they will send the results back to you.
Offer you further treatment.
So this is where I'm explaining that what will happen if we do surgery. The patient asks that, I don't want surgery. What happened in the surgery? So I'm trying to explain to the patient with a picture of available.
That supplies the thumb and the fingers here.
And these are the catalog of pictures.
Now, the numbness of your middle index, if we leave it at that.
That's another method of treatment you're showing to the patient. Any method, that's how you're going to be injection of treatment, wrist and so there's a lot of things. I mean, I don't want to really spend whole time here. I want to have the space for the next speaker. But I tell you what, if you don't learn it now, you will be forced to learn. Let's learn it. Thank you very much.